I just pulled up to a patient of mine, 79 years old, and he just had a lumbar fusion just 6 weeks ago. Guess what? We don't sit back and we don't relax. We're going to be getting him on the floor today. And we've been working on his strength so he can get on and off the floor, but we're going to be teaching him how and teaching him some critical exercises on what to do when you get hands and knees positioned. So come in with me, especially for his back. This is phenomenal for his spine. It's going to give a great stretch through your knees. Good stretch through the hips, but really we're after that low back and giving that a nice gentle stretch. But then again, depending on your ankle position, you can adjust those ankles to get ankle mobility, which is huge as we age because those ankles get really tight on us. It makes it harder to walk and do stairs. No. There you go. Good. Switching those ankles around. So this is to activate those little back muscles, and you're just going to bring that knee up just high enough you could slide fingers underneath. So even lower. There you go. Just barely bring it off. And then switch to the other one, barely bring that knee up. Perfect. Okay, and you're going to go back and forth just like so. By doing that, that activates those little muscles that run up the spine. And for you that just had spinal surgery, that's going to be huge because you need to activate those muscles because they've been shut down. Protective mechanism, going back and forth. And if you can, try not to shift too far back and forth, but just lift the leg up without shifting your body a lot. There you go. That's better. So yeah, it's a little bit smaller movement. But that's perfect, perfect, perfect. Now, do you think you could get on your toes and bring both knees up? Woo, good job. Okay, you okay? Mm-hmm. Good. And just bring both knees up. Barely bringing them off versus bringing them off a little higher. You're going to really feel those muscles pull. Now, is that okay on the back?
Yeah.
Okay, perfect. Okay, now just try a little bit of crawling. Good control. And, I know it feels a little silly. Now go backwards. Nice work, nice work, nice work. Okay, good job. Now go on the inside of your leg. Yeah, there you go. And just reach towards the ground. If it feels like too much, then either lessen up or we'll adjust it and put you on a chair.
Absolutely.
Okay, that's going to really, really stretch things out through your hip and your back. Just be really gentle with it. Because even a small movement like this is going to be beneficial for you. Mm-hmm. You don't have to do a big, crazy movement to get benefit. You just have to go to where your limitations are right now. So now, can you switch legs? Use the couch. Perfect. And then you're reaching down towards the floor. All right. Now we're going to get up. So use that couch. There you go. Push, strength. Nice work. Hey, look at that. Dude, that was awesome. That was so cool to see him get down on the floor and have the strength get up because we've been doing functional full body exercises for him to do that movement at 79 after all he's been through, just crazy. And so he's able to do that though because we've been training that full motion even without him getting on the floor. So just so cool to see him get there. That motion where he gets his knees just barely off the ground is just firing up those multifidus which run along the spine. So good. And then sitting back, when you sit back like that, hands and knees, you're working your ankles, your knees, your hips, and your back. Fantastic movement. Now there's modifications for it. He didn't opt to do a modification. He was able to do it, but there's modifications which I can show you and I have on my website on how to do those same kind of movements without having to get on the floor. So then you can progress to those positions on the floor later if your body's able to do that. So cool of him. I hope you enjoyed that. Hope that was beneficial for you. Let me know what questions, leave a comment below, and let me know if you need help progressing. I've got a whole program around it. Jump on my 30-day challenge and get your body moving. It didn't stop my man here at 79. Even though he just had surgery, he's still pushing himself. You can do it too.